Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Renal scan. The renal scan and the cardiac scan as well as the SPECT. So let's look into this. So iodine 131. So iodine 131, hip urine, it was earlier used to quantify the renal function. Image quality is poor, so it has a poor image quality. The radiation dose, it can be high and hence it is no longer used. In case of routinely it is no longer used. Now looking at the TC99M DTPA. So what is the use of this DTPA? So here there is a diethylene triamine. So diethylene triamine penta-acetic acid. So there is an estimation of the GFR. There is a vesico-urethric reflex VOR as well as in case of the renal tract obstruction. Then comes the TC99M DMSA. The DMSA is dimercaptosuccinic acid. So it is a succinic acid. There is the renal cortical and the parenchymal imaging, the cortex. So renal cortex, the cortical and the parenchymal imaging. Then comes assessing the differentials as well as the relative renal function. It is particularly used in pediatric imaging for the detection of scarring. So it is used for the detection of scarring, the pyelonephritis, as well as the DMSA is an ideal agent for the assessment of the renal cortex. Now we move on to the TC99 MAG3. So here in MAG3 it is a meta-carboacetyl, so acetyl triglycine. So here in MAG3 it is used for assessing the renal blood and the plasma flow. So renal blood flow as well as the plasma flow. On the other hand, TC99 DTPA, there's a diethylene triamine penta-acetic acid. This was for the GFR and the VOR and the renal tract obstruction. Now moving on, getting back to the MAG3 for renal blood and the plasma flow and assessing the function of the renal tubules. So tubules as well, this is the MAG3, renal tubules, renal blood flow, and also in case of the collecting ducts. Now let's move on to what is the cardiac scan. Here in the cardiac scan, it is the myocardial perfusion imaging, that is nothing but the MPI or the nuclear cardiac stress test. Nuclear cardiac stress test. And it is a non-invasive method. It is totally non-invasive. It is a non-invasive method that uses the radioisotopes to assess the regional myocardial blood flow. So to assess the regional myocardial blood flow. Then comes the function and the viability and the diagnosis of the CAD. Now looking at the normal myocardium. The normal myocardium, it appears hot and ischemic infarcts. So ischemic infarcts, if you see, it appears cold. Ischemic infarcts appear cold. The reversible ischemia is indicated by cold spots. So reversible ischemia is indicated by the cold spots that returns to normal hot after the 4 hours of rest. After 4 hours rest, it remains hot. Now the PET scanning for the myocardial metabolism, it is using the 18 FDG. So you have 18 FDG. This has become the gold standard and non-invasive test. So it is non-invasive test to evaluate the myocardial viability. Then comes the MPI by the PET scan. So MPI by the PET scan. So MPI by the PET scan, it is more sensitive. It is sensitive and it is specific than the PECT MRI. It is specific than the PECT MRI. And then comes the Muga scan. The Muga scan, it is using the TC99. Muga scan is TC99 labeled serum albumin. So serum albumin and or the RBCs, serum albumin or the RBC. It is the most accurate method for measuring the cardiac. Ventricular ejection fraction. So it is a Muga scan, MUGA. MPI by SPECT scan, it is sensitive and specific for the SPECT MPI. Then lastly, the cardiac CT. The cardiac CT is done in mid diastole. So this is done in the CAD as well as the coronary calcium scoring. So it is done in the CAD and also the coronary calcium scoring. Now let's move on to the SPECT. SPECT is nothing but the single photon. It is single photon emission imputed computed tomography CT. So this is a nuclear medicine. It is a nuclear medicine imaging technique. So it is a nuclear medicine imaging technique. It is used for the gamma camera to image the injected radioisotope. It is used for the functional imaging of the cerebral and also the cardiac perfusion. In SPECT, because only a single photon is emitted from the radionuclides. So single photon is what is emitted from the radioisotopes. A unique lens, it is known as a collimator. Unique lens is known as a collimator, and it is used to acquire the image data from the multiple views around the body. And the use of the collimator results in a tremendous increase in detection of the efficiency compared to that of the PET. So it is more efficient compared to that of the CT. To learn and grow daily like this, please do subscribe.